my name is Camila Noriega, and today I'm going to be doing my demonstration speech on how to tie a tourniquet and phlebotomy. Imagine going to get your blood drawn. You probably expect cleanliness, safety, and you expect that the tools used are safe for you. One of the most smallest but important tools in the process is a simple elastic band, the tourniquet. Today, I'm going to be showing you how phlebotomists properly apply a tourniquet and explain why hygiene and safety are just as important as the technique. Why hygiene matters with tourniquets. Before we go into how to tie a tourniquet, it's important to understand a critical safety issue. Reusable tourniquets can carry dangerous bacteria if not properly cleaned. In a study based on reused tourniquets, researchers found that many were contaminated with pathogens, including the MRSA, posing a real risk to patients. Because of that risk, many phlebotomy professionals now use a single-use latex-free tourniquets. Phlebotomy U explains that this practice helps avoid allergic reactions and significantly reduces the chance of infection transmissions between patients. So when I demonstrate the tourniquet, I'm using one of these single-use type to emphasize hygiene and safety. Now I'm going to be showing you how to apply the tourniquet. First, we want to position the arm. I'm going to be using a water bottle. Have the patient, or in this case, my water bottle, extend their arm palm down and place the tourniquet about 3 to 4 inches above where the needle will go, which is the middle cubit. Next, we're gonna wrap the tourniquet like this. We wrap the band smoothly around the arm to make sure it lies flat and it's not twisted. Now we're gonna be tying it with a quick release loop. We get the two ends, we cross the ends and make a small loop, and then tuck one end and pull tight. But make sure it doesn't go all the way through, or else it's going to be harmful to the patient. But it lets you release it instantly once blood flow starts. Now we're gonna check for tightness. It should be snug enough to make veins visible, but not so tight that it's painful for the patient. You should be able to slide your finger under it. Next, we're gonna release promptly. Once the needle is inserted and blood begins to flow, release the tourniquet immediately. It should only be under a minute long where the tourniquet is tied. Safety reminders for phlebotomy. Using a disposable tourniquet for each patient helps prevent cross-infection. That was proven necessary by studies showing high bacterial contamination on reusable bands. Proper hand hygiene, like washing hands before and after each procedure to each patient, also plays a key role in preventing contamination. When tourniquets are reused, pathogens can transfer from one patient to the next if the band or hands are not disinfected. Make sure you use gloves. These standards ensure that patient safety and uphold best practices in our phlebotomy technique. I just showed you how to tie a tourniquet, but why is it important to use one carefully and hygienic? A simple band can become a vital safety tool, and when used correctly and responsibly, it can be really great for the patient and for the procedure. If not used correctly, it can cause bruises or hematomas when you're inserting the needle. Thank you, and remember, small steps like using a clean tourniquet can make a big difference in patient health and safety.